In this section now we will talk about some benign tumors of the small intestine. Since we are talking about the upper GI tract cancers in our today's lecture, we already discussed about the esophageal cancers. Then we talked about the gastric cancers, in which the gastric adenocarcinoma is the most common. Then we discussed the gastric lymphomas and gastric sarcomas. So that concludes the esophagus and the stomach. Now the third part of upper GI tract is the small intestine, and small intestine is comprised of duodenum, then there is jejunum, and then ileum. All these three structures make up the small intestine. So in this section we will talk about the benign tumors of small intestine, which will be adenomas and polypoid adenomas, leiomyomas, and some other benign tumors beside adenoma and leiomyomas. Tumors of the small intestine, benign tumors, are the adenomas or the tumors that develop from the glandular tissue of the small intestine. Here you can see the picture. All this folded portion is the jejunum of the small intestine, and this is the tumor or the growth. Adenomas can be polypoid adenomas, which look like the polyps, and leiomyomas, lipomas, and angioma. These are the different types of benign tumors of small intestine. We have adenomas, polypoid adenomas, leiomyoma, lipomas, and angiomas. 5 different types of benign tumors of the small intestine. Malignant tumors are adenocarcinoma, lymphomas, carcinoid tumors, leiomyosarcomas. Benign tumors, let's go over the benign tumors first. Adenomas. Adenomas are the benign tumors of the small intestine. Islet cell adenomas are outside pancreas. Brunner's gland adenomas, they are due to hypertrophy or hyperplasia of submucosal duodenum. So Brunner's gland adenoma are due to hypertrophy of the duodenal submucosal duodenum, and duodenum is the first part of the small intestine, C-shaped structure, where the pancreas are very closely associated with that structure or the duodenum. So here the adenomas, islet cell adenomas, are outside the pancreas, and Brunner's gland adenomas are due to hypertrophy and hyperplasia of the submucosal duodenum. You can see the hypertrophied cells present on the histological picture. Alkaline mucus synthesis. Polypoid adenomas, another type of benign tumor of small intestine. Polypoid. They are small bowel or small intestine tumors in duodenum mainly, usually hematomas. Malignant degeneration is low, and they are autosomal dominant. So polypoid adenomas have genetic predisposition also. They are autosomal dominant type of benign tumors. The malignant degeneration or change to malignant tumor is low in polypoid adenomas. Polyps are the structures or the that hang from the mucosal wall. Polyps can be sessile polyps with no stalk, or they can be pedunculated polyps. So in this we have the polypoid type. They look or they appear like the polyps. They are in the duodenum is the site which are affected mainly by the polypoid adenomas, and they are autosomal dominant, and there is like condition like familial polyposis they are all the condition in which polyps are formed. They are autosomal dominant and they have genetic predisposition. Another benign tumor is leiomyomas. Leiomyoma is from the intestinal smooth muscle. Intramural affect mucosa. Mural is the cavity opening and it affects the mucosa, and these are the tumors or the smooth muscle tumors, leiomyoma. Very common type leiomyoma are common benign tumors in different parts of the body, like fibroids and fibromas, and leiomyomas are also common in the uterine cavity. They are intramural or inside the cavity. Cramping or abdominal pain is associated with leiomyomas. Ulceration is also present in leiomyoma. Another benign tumor is the lipomas. Lipo is fatty tissue, so lipomas are also present in ileum and at ileocecal valve. Ileum is the last portion of small intestine, and at the end of the ileum there is ileocecal valve. So this is more common in the ileum and the ileocecal valve, lipomas. Radiolucent appearance, asymptomatic. They do not have symptoms. There are no symptoms present, so it's hard to diagnose lipomas because the patient is asymptomatic. Cause bleeding. Another type of benign tumor is angiomas. They are not true neoplasm, form of telangiectasia or hemangiomas that develop from the blood vessels and the capillaries. GIT or jejunum is affected. So different type of benign tumors affect different parts of the small intestine. Some are more common in duodenum, some are in the jejunum, and some are more common in the ileum. Lipomas are asymptomatic and angiomas are mainly the form of telangiectasia or hemangiomas. Angiography is done for evaluation because they are in the blood vessels, develop from the blood vessels. Angio is blood vessel, oma is the tumor. So angiography or examination of the blood vessel is helpful in the diagnosis of angiomas. This was all about section 4. Thank you for watching sqadia.com.